Welcome those attending as well as those online joining us via webinar. This is a large group session, part of our seminar in humanitarian health that Paul Spiegel and I co-teach. And the large format involves webinars and the general public invited to join a smaller cohort of our registered students in the concentration and certificate programs. And the topic today, as you'll see on the slides, is migration and health, concepts, categories, and global governance. And I'll launch things off with a few terms and concepts, and then hand things over to my distinguished colleague and friend, Beth Ferris, who I'll introduce more properly in just a bit, who comes to us from many different contexts and locations and roles around the world in refugee and migrant advocacy, health, human rights protection, but is currently research professor at the Institute for Study of International Migration at Georgetown. But more on that later. I will talk about some of the concepts and categories. Beth will then take us more into sort of global governance issues, migration and health, with a conversation about where this work is trending in terms of trying to bring together worlds that were somewhat separate. The world of migration, largely seen as voluntary, and the world of displacement or forced migration, largely seen as the name implies, forced, compelled, with refugees and internally displaced populations. And now the effort by many, not all, is to see if there's a way to bridge this in the overall framework of migration and health, and we'll talk about some of the initiatives underway, and as Beth will talk about the possibilities and the pitfalls. So, some concepts and categories: refugee versus migrant, what's at stake. Some of you will have seen a modified version of this in the Intro to Humanitarian Emergencies class, so some repeat, but for this more general audience, I thought we could go over some of those points, and then we'll talk about the New York Declaration on refugees and migrants, and hand things over to Beth to pick up from there. Talk about the compacts and some of the global governance issues. So, lots of different categories to talk about. Some of them you know, some of them you may not be as familiar with. The ones in bold we'll talk about. The ones not in bold we may discuss later, but not in such detail. So IOM, one of the entities playing a key role in this discussion, defines a migrant as anyone who's moving across an international border within a state, away from an habitual place of residence, regardless of legal status, voluntary or involuntary movement, and what the causes are or what the length of stay is. Very broad. Everybody who moves, essentially, is a migrant. As distinct from refugee, who, owing to a well-founded fear of being persecuted, is outside of their country of habitual residence and has a well-founded fear of persecution based on these 5 categories: race, religion, nationality, membership of social group, political opinion, and is unwilling or unable to avail himself of the protection or herself of that country. Sorry, am I too far away from the mic? I wander. So there we go, migrant, refugee. The migrant definition, as you can see, overlaps with people moving involuntarily. The refugee definition is quite distinct. Is this a useful overlap or not, is I think the core of the debate. Stateless persons, people who are not considered citizens or national under the operation of any laws of any country, effectively without identity. Probably the most salient population right now would be the Rohingya inside Rakhine State and outside in Bangladesh, who, at least according to the Burmese government, more or less are being told, you don't belong here. We do not have claim to you. You have no claim to us. And if you leave, or if you stay, you are a foreigner. And then whose country do they belong to if they do not belong to Myanmar? And that, to my way of thinking, is suggesting that the people who have fled, now nearly 800,000, will have a very long, hard time getting any place that recognizes them as having identity. Asylum seeker is someone who seeks a request or makes a request for sanctuary but has not yet been processed. That's UNHCR. There's a longer definition or understanding which says that they're people simply awaiting a claim, so they could include refugees whose claim being recognized then deems them refugees. They could be denied asylum, in which case they become what? Migrants, nothing, externally displaced, deportees, illegal aliens, and the rest. So they're in this, in a sense, kind of a limbo status. IDPs, according to guiding principles, and Beth has done a lot of work on this and can speak more to that, maybe you can just jump right in, people who have been displaced inside their country for reasons that might be refugee-like or related to natural disaster, generalized violence, large-scale violations of human rights, and have not crossed an international border. So difference from refugees too, not crossed an international border and displaced for reasons that would be not deemed consistent with refugee definitions, even if they would be displaced across a border. You don't become a refugee if a flood displaces you from your home. And you don't necessarily become a refugee if war displaces you. You must be deemed having a claim to a well-founded fear of persecution based on 5 specific criteria. And then we have disaster-induced displacement. Part of the IDP framework, which is not a law, it's not a treaty, it's a normative framework. But if these populations are moving across an international border, the question is, who is responsible for their protection, for their health, for their well-being? Not clear. Development-induced displacement. I wrote a paper for Brookings a number of years ago. Guiding principles frames out as included within the IDP definition people who are displaced arbitrarily by large-scale development that's not justified by compelling or overriding public interest. If I build a golf course through a population of indigenous peoples and I displace them and they're homeless, under this terminology, they would be IDPs because there's no overriding public interest in somebody having a place to play golf. But what if it's a train track? Is there overriding public interest? What if I'm moving them out of public interest to quarantine them because of some health or epidemic outbreak? It's murky. And there's millions and millions of people just in India alone within this context. Again, who sort of speaks on their behalf? What protection mechanisms are they able to avail themselves of? This is a population sort of pushing toward increased visibility on the part of the international community, and the question is, who plays what roles in their protection and what are their health concerns? And then trafficking, long, cumbersome, frustrating definition, the basic gist of which says if you're transported or recruited or harbored or moved and you're deceived in that process and the end result is exploitation for labor or sex or organ harvesting, you're a trafficked person. Could be internally within the country, could be externally. And those laws and frameworks, the Palermo Protocol is the most significant and globally sort of overarching. But then again, the question becomes, within our framework that we're positing, migration and health, where do these populations fit in? Can some of them also be refugees? Can you think of examples where that might be the case? So I do a lot of work in Thailand, just came back yesterday, so I'm a little jet lagged. What if you're a Rohingya and you've been trafficked into Thailand and you're identified as a victim, and the response is, we find you and we send you home again for your protection. And you say, no, I'm fleeing genocide. do you have a claim to refugee status, even if you're also deemed a trafficked person, and the protection mechanism for trafficked person is to send you back home? The assumption being you're safer there than where you've been trafficked into. Are there gaps that need to be addressed? Are there overlaps that might be actually fruitful? And so we have these old paradigms of sort of involuntary on one side, voluntary versus the other, refugee versus migrant, internal versus international. And maybe I would propose to you that there's a new paradigm that says there's kind of a continuum. One of the people who's done work on this is Nick Van Heer. This may be an old slide. It's a little busy and complicated, but look at it for a moment. We have, instead of a dichotomy, a continuum, right? So here we have our involuntary migrants, right? There's our refugees, there's our IDPs, there's some development displacement, asylum seekers, all those sort of folks that tend to show up when we're talking about humanitarian populations in need of protection and assistance. But here in this middle ground, economic labor migrants, rural, urban, returnees, people coming back from a place of persecution, or a place of asylum, I should say, to a place where supposedly persecution has ended, but they're back again. Here with more proactive, fully voluntary tourist visitors, students. So nobody forced you to come to Hopkins. You're here of your own free will. You can go back again when you want. Nobody necessarily has any particular concerns about your situation. But what if you're here without proper documents? A dreamer. What if you're here from a country that you may fear returning to? How do we sort that out? So Van Heer says it's not really clear. It's not dichotomous. It's not black and white. This continuum is important to think about. And again, much of the debate about migration and health is really about this middle ground and how people can kind of move back and forth. Because you're one thing at one time doesn't mean you're that thing all the time and in all contexts. So refugee or migrant, which is right? I'll give you the UNHCR spin. They're propaganda. And Paul he's been there, he knows this very well. So this comes from UNHCR. And their argument is word choice matters. Right? Refugees, we talked about this, people fleeing armed conflict or persecution. They cross an international border or national border and they seek safety and become recognized and have access to assistance, and they are so recognized precisely because it's too dangerous to return home and they need sanctuary elsewhere. That, in HCR's view, is what makes a person who is a refugee distinct from a migrant. They're defined and protected in international law, and they should not be expelled or returned or refooled to a place where their situation, their life or freedoms are under threat. And thus protection is fundamental in many aspects, but states have the primary responsibility for this protection. Cross an international border, cannot return to one's country of origin, and therefore needs specific and special protections under international law. As distinct from migrants, according to HCR, who move not because of a direct threat of persecution or death, but mainly to improve their lives by finding work. In some cases, education, family reunion, and so forth. And if they return, they will continue to receive the protection of their government. And I would suggest this is the crux of the debate. Do they? Can they? Will they? Or is part of their movement process, without documents, possibly with other vulnerable characteristics, rendering that return problematic in some ways that are so fundamental that their lives and certain freedoms could be also threatened, not as refugees, but in other ways. And I think that's the crux of the debate, at least that's how I kind of see it. So for individual governments, says HCR, this is important, this distinction. Countries deal with immigrants and migrants under their own immigration laws and processes. Refugees are determined by national and international law. Okay? So conflating these two, again, the HCR view is has serious consequences for the safety and well-being of refugees. It's a rare coin. You debase it by spending it too and interpreting it too liberally and bringing in all these people who really are moving for lots of different reasons, but fundamentally can enjoy the protection of their home country and government should they return, voluntarily or involuntarily, deported or not. It's not of consequence, at least according to HCR. And blurring these two takes away from the specific protections that refugees require and can undermine public support, because if people stop seeing refugees as distinct and they say, well, I can't really tell the difference here between that Syrian who came with refugee status and that Mexican who came without documents and that student who overstayed a visa, they're all the same. It arguably, again, according to HCR, debases the commitment to distinguish the person who leaves based on a well-founded fear of persecution and cannot return home from somebody who leaves for other reasons and can return home. So that's a very simplistic way of framing it, but this is sort of their words. So now, rather than give you the IOM perspective, I'm going to give you a New York Declaration for Refugees and Migrants. Beth can talk more about this and the compact involved. So this is some language. This is in your readings. This could be on your quiz. Do we have quizzes? I don't know. Rats. Yeah, that's good. Maybe we'll have quizzes. Okay, so more people than ever before live in a country other than the one in which they were born. Does that surprise anybody? Why is that sort of striking, and why is that maybe not quite so striking as all that? Yes, Amy.
The world population has grown, so the number of migrants would also likely grow.
Thank you very much. So there's 7 billion people in the world. When there was 1 billion people, you didn't have as many refugees. You didn't have as many anybody's. Right? So we have more refugees than ever before, not just because we have massive displacement from places like Syria and otherwise. I'm not diminishing that point, but there's just more people. And so more people affected by forced displacement. But we have some big numbers here. 244 million who are not living in the country of their birth, okay? One of the ways that migration is measured rather simplistically, but at least with some sort of rigor by a lot of international entities. 65 million forcibly displaced, 21 million refugees, 3 million asylum seekers, over 40 million IDPs. So we have big numbers. That's partly because of these forces of displacement and disruption around the world, but also partly because we have more people in the world than we've ever had before. Okay, this is from the New York Declaration, so hence the quote, it's not my words. Refugees and migrants have the same universal human rights and fundamental freedoms, even though their treatment is governed by separate legal frameworks. So that's what the New York Declaration is trying to say, is refugees and migrants, not refugees versus migrants, refugees and migrants. Not exactly the same, but have certain basic, universal human rights, face many common challenges. Large movements may involve mixed flows of people. So here we introduce a concept that is kind of particular to this discussion. They're not saying in all contexts we have to think about refugees and migrants together, but when we have large movements and they're mixed flows, maybe we need to think about a comprehensive kind of strategy and solution, hence this declaration and compact and many things to follow that Beth will talk more about in just a minute. So we recognize and will address, in accordance with our obligations, the special needs of people in vulnerable situations who are traveling, notice this, within large movements of refugees and migrants. So let's not separate them out, says this argument. Let's keep them together because that's how they're moving. And look at all these people. Women at risk, children, special those unaccompanied, separated, ethnic and religious minorities, victims of violence, including intimate partner violence, gender-based violence, older persons, disabilities, discrimination on any basis, indigenous peoples, victims of human trafficking, and victims of smuggling. A much bigger universe. A much bigger universe within this context of large movements of refugees and migrants. So that's where we are. Is there a reason to be endorsing, embracing this idea that when you have large movements of mixed flow populations, you really need to encompass all of these people, including refugees, in your focus on protection, on health care, on livelihoods, on durable solutions? Or, if we do that, do we water down and debase and diminish resources that should be specifically targeted for refugees? Can you have it both ways? Or is having it both ways going to cost, at least as HCR argues, refugees? And might it also cost other specific needs that would be better served by targeting resources instead of sort of throwing everybody in this big umbrella and saying large-scale movements of refugees and migrants and throw them all in the mix and then you figure out who to help with limited resources. So now I move on to Beth's time to talk. I won't get into all of her many distinguished characteristics, but research professor with the Institute for the Study of International Migration at Georgetown, formerly with Brookings Institution, the LSE, London School of Economics, project on internal displacement. She was there from 2006 to 2015. She was 20 years in Geneva with the World Council of Churches, where I think we first met on Indo-Chinese refugees. How many decades ago? We won't say. And a large and distinguished body of work and scholarship. And because we're academics, we have to say where she did her training. So she had a BA from Duke and MA and PhD from University of Florida. So it gives me great pleasure to introduce to you Beth Ferris.
Well, thank you very much for that nice introduction. I should add that I spent last year, the year of 2016, in New York, first in the UN Secretary General's office and then working with UNHCR in the whole lead up to these processes around the New York Declaration. And what we now see is the possibility of negotiating these two global compacts that I'll talk about in more detail. I must say it was a fascinating experience. Most of my work has been in the field, doing humanitarian work or later writing about it. But to be involved and watch these negotiations between governments and see the extent to which attention would focus on a single word, sometimes for weeks. I was the author of the Secretary General's report that fed into the New York Declaration, which itself was a process of consultation with 20 UN and international agencies, 80 governments. So every word was already the product of consensus and deliberation. But to watch a phrase such as detention of children occupied governments for literally weeks, hours and hours of debate on whether detention of children is ever justified. And what I had written, I thought, was a very nice, simple sentence. Children should never be detained for immigration purposes. Became a very long, convoluted sentence, something like, in most cases, wherever feasible and in accord with national law, and until we can develop alternatives, we should try not. It was that kind of a sentence, which for an academic just is really grating. But I'd like to talk about the possibility we have now in terms of negotiating these compacts. These compacts will be negotiated by governments. There will be a lot of attention to specific words. We've talked about, your court has given you an overview of some of the different words and labels we use, and these matter. But if you step back and look at global governance, we have two very different systems. In terms of refugees, we have a strong international convention, 1951 Refugee Convention, a binding obligation on states that have ratified, and today about 145 states have ratified that convention. There is a single definition everyone accepts perhaps imperfect as it is. There is a single mandated international organization, UNHCR, is given the mandate by the international community back in 1950 to protect and assist refugees. On the migration side, it is a whole different ballgame. There are a lot of different international laws, maybe 9 or 10, that apply to migrants as they apply to all human beings. But there isn't one single convention guaranteeing the rights of migrants in particular situations. There is no agreed definition. Court cited one. Within the UN alone, there are 5 different definitions of who is a migrant. Some include internal and cross-border. Some consider people in transit, for example, now in Turkey or Libya, as being migrants. Others say, no, you have to have lived in a country for at least a year before you can be considered a migrant. Lots of different organizations and lots of informal processes outside of the UN. These are 2 very different systems. As Court said, the New York Declaration called for the negotiation of 2 new global compacts in 2018, one on safe, orderly, and regular migration, and one on refugees. These are different processes that will be used in developing these compacts. They're both going to be state-led. That means governments are going to negotiate them. This awful word, multi-stakeholder process, it's an awful word. But it implies, it's not just governments, but civil society and academics and the World Bank and the private sector and so on will be included in the consultation process. But the one on refugees is under the control of UNHCR. UNHCR is asked to develop this compact and to present it in a report to the General Assembly next fall. In terms of the migration compact, there's a very brutal series of consultations going on now. The President of the General Assembly is in charge of the process, has named 2 experienced diplomats to guide it, but it's a different process. And in this context, it'll be interesting to compare what comes out of the 2. Neither of these is going to be a binding legal document. They're going to be non-binding affirmations of principles and commitments. Neither global compact is likely to include IDPs. If you look at the 65 million figure of forcibly displaced people in the world, 2/3 of those are IDPs. Neither of these contacts is going to deal with this large group of people who frequently have very serious protection and assistance needs. There's going to be clear overlap. People are watching very carefully to see if these 2 different processes will recognize areas where they need to collaborate and come up with possible commitments to address the needs of those who aren't formally refugees, but who have serious protection needs nonetheless. So different processes, different actors, different time frames. Probably the Global Compact on Refugees will come up next September. The Intergovernmental Conference on Migration will be in December in Morocco. Different venues. If you look at it from a diplomat's perspective, expertise on both migration and refugees largely rests with diplomats in Geneva. Diplomats in New York, have been following the big issues of war, peace, security, peacekeeping, development, etc. So the one on refugees is being negotiated in Geneva. The one on migration is being negotiated in New York. So different actors within governments will be involved, and different expectations. But most of all, this is a really lousy time to be trying to advance the human rights of either refugees or migrants. The toxic discourse against migrants, whether it's in Europe, in our own country, and many other places, it's a really chilling effect to think about trying to move us forward in terms of states' commitments to ensuring that all those who cross borders have their basic rights respected. So the danger is one that either one or both of the compacts fails to deliver something that governments can endorse. And that would be awful. It would be a recognition that the international community can't agree on how to treat one of the most burning issues of our time. Or in worst case scenario, maybe they adopt compacts that actually move us backwards particularly on the migration side, I think there's a very real risk, given the toxic discourse and populist politicians, to be seen to be strong on border management, border control issues. So it's a high-risk endeavor, but it's also an unprecedented opportunity. Never in my lifetime, and I suspect never in yours, will there be this level of high-level political attention to migrants and refugees. You know, until 2015, this was largely left to the specialists, whether it was the particular UN agencies or within a few governments who were particularly interested in it, but it wasn't usually an issue for the Security Council or the General Assembly. And so there's a sense that, oh, we've got this opportunity. Let's see if we can make the most of it on both refugees and migration, in spite of this deplorable political climate. So stay tuned. It's going to be quite a ride, I'm sure, over the course of the next year. Let me talk a little bit about migration and why it's so difficult to get governments to agree on certain principles. First of all, it's all about sovereignty. It's the quintessential hallmark of a government's sovereignty to determine who is allowed to enter a country and who is allowed to become a citizen. I mean, that's just fundamental. You know, nobody questions the right, even of very fragile states, to decide who is allowed to enter. In the case of the Refugee Convention, governments that have signed it have in effect given up a little bit of their sovereignty. They said, we will control who enters our country, who crosses our borders, but because we've signed this convention, we promise that we'll let those fleeing persecution stay, at least not send them back to countries where their lives are in danger. Since 9/11, the threat of terrorism, security concerns, what we call the securitization of the migration debate, has become paramount. Everybody talks about it, not just Donald Trump and the EU, but you hear it from governments of many countries. You know, we're concerned with not letting in a terrorist. Security trumps human rights in many cases in deciding who is allowed to enter. There are real practical problems in how you go about harmonizing policies and coming up with consistent standards on the migration side. And to be honest, there's this relative indifference of major destination countries. Those who are pushing migrants' rights are the countries from which migrants leave. So government of the Philippines, of Mexico, Colombia, are very strong advocates for protecting migrants' rights. For those in the countries to which they arrive, the destination countries, not so much. You know, so you have a situation where countries in the global north are really concerned about controlling, stopping, limiting migration, particularly irregular migration. High-skilled migration, safe, orderly, regular migration, that really isn't an issue. But the irregular migration is something that developed countries want to stop, while countries in the global south, from which many of these migrants come, are most interested in protecting their rights. So often in these negotiations, you've got governments talking past each other. You've got, you know, governments on the one hand upholding rights, and then you've got governments talking border control, and there's not a whole lot of common space in there to think about moving forward and developing a consensus. These are just a list of some of the international laws that apply to migrants. This wonderful Migration 1990 Convention on the Protection of the Rights of All Migrant Workers and Members of Their Families is probably the best and the strongest legal instrument on migration, really referring just to migrant workers, those who are paid for their services. But this convention has only been ratified by governments of sending countries. No major destination country has ratified it. So no North American country, European country, the country to which migrants go. None of the countries in the Gulf, which receive a lot of migrants, particularly from South Asia, has ratified this convention. And every single statement of commitment or affirmation or resolution calls on governments to ratify this convention. But a lot of governments aren't eager to take on new obligations, and there are new obligations in that convention, particularly for irregular migrants, that make some governments very, very nervous. Even liberal progressive governments aren't really willing to give irregular migrants all of the rights that are included in this convention. And then there are the tons of actors. International Organization for Migration, set up originally outside of the UN, primarily by the United States, to be a vehicle for dealing with issues the UN just couldn't deal with in the early years. Particularly because at that time it did not include the Soviet Union or China. It was basically friendly governments. IOM, the International Organization for Migration, has gone through a lot of change in the past 50 years. And last year, IOM formally entered the UN for the first time. Many of us hoped that this would bring IOM closer to the UN and closer to adoption of basic human rights principles to undergird its action. So far, we haven't seen that. We've seen the Director General, Bill Swing, who's an amazing character, but he continually repeats, just because we're in the UN doesn't mean we're going to change one bit. We're going to continue to operate the way we've always operated, flexible, nimble, cheap in terms of UN institutions. So we'll see. You've got UN Department of Economic and Social Affairs, DESA, which is responsible for all these statistics. They produce the authoritative numbers, such as the 244 million international migrants now. ILO has done some really important stuff on protection of migrant workers. OHCHR is also involved, often quite extensively involved in issues of migration. UN Office on Drugs and Crime that works on trafficking, smuggling, but also other issues around migration, and gets a lot of support from governments. Then there are a lot more, and I won't go over all these, but there's a special representative of the Secretary General, there's a special rapporteur on the human rights of migrants. The Global Migration Group is 21 different international entities, mostly UN, also the World Bank, working on migration issues. And then all these informal bodies. The Global Forum on Migration and Development was set up as a way of allowing governments to talk about migration, because governments were really afraid to bring this to the UN. They were afraid that it was too contentious, the North-South divide was too strong. Let's have some informal, loose, come if you're able, if you're interested, forum to talk about these issues. And it's worked actually quite well. And then dozens, I'm not exaggerating, dozens of processes on the regional level. If you look at what's going to be on the agenda for this new global compact on migration, there are a total of 24 issues that are listed, but a lot of them there are a lot of issues. Some of them are not very controversial. Everybody agrees on the need for more safe, orderly, and regular migration. Not so clear on governments willing to offer more migration possibilities to those seeking entry. Everybody agrees that remittances are really important and have been key to not only development but to survival in many countries, and great to recognize the importance of remittances, but differences in how those are seen. Governments, used to be really skeptical about talking about these things at the UN. They're still a little bit skeptical, but more willing to discuss the issues. A lot of benefit in talking about migration and development. That's not controversial. And until now, there's been this agreement that processes should be state-owned, non-binding, and stay outside the UN. Now they're talking about doing this inside the UN. And then this particularly pesky issue that Court referred to. In the New York Declaration, it's called Migrants in Vulnerable Situations. If you look at the literature, we've got vulnerable migrants, forced migrants, crisis migrants, survival migrants, and migrants at risk. And a lot of different terms, sometimes applying to the same people, sometimes somewhat different. So the New York Declaration said, let's not assume that all migrants are vulnerable. There are some strong migrants out there. But let's talk about situations which increase vulnerability. Some of those taking these risky journeys across the Mediterranean, regardless of whether they're leaving because of persecution or because of poverty, some of them go through absolute hell to make that journey, and many of them do not survive. Could we look at those situations and come up with some general guidelines on how government should deal with these? Well, the New York Declaration said, let's set up a state-led process, that's code for government-controlled, state-led process to develop guidance on migrants in vulnerable situations. But until now, no governments have stood up to take on that process. Nobody has shown a willingness to begin opening that perhaps Pandora's box because of the political sensitivities. I think it would be real helpful for maybe the academic community to step back and just define who is included in that and what particular protection needs do they have. Unaccompanied children probably have different protection needs than women who've been trafficked, for example. But maybe to depoliticize it a little bit and to look at who we're talking about and what might be needed. So the Global Compact on Migration is addressing all of these issues. It's not clear what format it will take. It has been a brutal process. I mean, I really feel for the people in these international organizations and governments going to all of these meetings. Just for the migration side, you've got regional meetings. And within regions, you've got sub-regional meetings. And then meetings of regional organizations. And then you've got thematic meetings, so one on smuggling and trafficking in November, one on global governance, there have been 6 of those. Then you've got stock-taking meetings. Well, how do we put all this together? Then more of these multi-stakeholder meetings, intergovernmental dialogues, and we haven't even gotten to the negotiations. This is all going to happen by the 18th of December on the migration side. The idea that the Secretary General's report in January, come up with a zero draft, as the UN likes to call things, of the draft compact in January, and negotiations will begin in February. But just for people trying to participate, just reading all of this stuff, I mean, I'm talking thousands of pages of government submissions and NGO ideas and so forth. Surprisingly, when I knew I was coming here, I looked on the website, and IOM has a very nice website on the Global Compact with tons of information, but there's hardly anything on health. There's a reference to the Colombo Declaration, but health is not high on the agenda for the Global Compact on Migration. And as I was saying, it's not high on the agenda on the refugee side either. I would think that there's a possibility, Court and some of you, to write something short and post it on those websites, so at least there's a resource to feed into these processes when people say, oh yeah, we ought to do something on health. What should we do? Anyway, to have some ideas to include, I think would be very useful. On refugees, it's likely that the Global Compact will reaffirm the convention, the core principles of refugee protection. We hope that it will include discussions of responsibility sharing, which is the big weakness of the refugee regime. Refugee regime is really good at setting out who's to be protected and so on, not so good at saying how we're going to do this. But the idea in the beginning was that it shouldn't just be the responsibility of the government which ends up receiving refugees to make sure they're cared for and protected. It should be an international collective responsibility. That hasn't worked very well in Europe. There was a relocation scheme that the Syrians and others arriving would be distributed on a fair basis throughout the European Union. That hasn't worked. But some form of responsibility sharing globally is desperately needed. So just like there are a lot of consultations on the migration side, on the refugee side, there have been tons of consultations, not quite as many as on the migration side, with the whole process of over the past 6 months, again, leading up to some synthesis in December of this year. But what we see, because we're negotiating 2 global compacts, the division between refugees and migration is becoming stronger than ever. UNHCR, for its part, sees what's happening to refugees in Europe and elsewhere, and wants to hold on as much as it can to the distinct definition and characteristics of refugees, is becoming less willing to talk about, areas of overlap. While on the migration side, there's a feeling that, well, this is, refugees are a subset of overall migrants, and therefore we need to do more. And when you've got high visibility issues, everybody wants to be involved. Since 2015, when large numbers of people arrived in Europe, we have seen a plethora of organizations, institutions, professors, journalists looking at refugees and migrants for the first time. I was at Brookings, and I used to, beg my colleagues, oh, why don't you talk about refugees when you're talking about Iraq or Syria? And they'd say, oh, no, Beth, we deal with hard political issues. You do the humanitarian soft stuff. And then, shortly after I left, everything broke in Europe. And by golly, there were 15 or 20 scholars organizing meetings on refugees because it's a high visible issue. And to demonstrate your relevance, you need to be shown to be active in the process. So on the refugee side, we're likely to see a plan of action for a comprehensive refugee response framework that's already in the New York Declaration, maybe something on responsibility sharing and some strong commitments within what they call the preambular language. But the stakes, I might say, are much higher on the migration side. I think that we will get a global compact on refugees and on migration. But if for some reason we don't get a global compact on refugees, the New York Declaration already gives UNHCR lots of possibilities to move forward in new ways. And UNHCR already can figure out how to make that work in practice. What we'd be missing would be some affirmation of responsibility sharing. If the global compact on migration collapses, it's unlikely that IOM or any of these many organizations working on migration will have such a clear mandate and ability to go forward just based on the New York Declaration. So we're going to have all of these processes going to continue, lots of efforts to influence the process. We really hope that we can move forward on both migration and refugees to get more government commitment to respect the rights of those who cross international borders. Let me just say a word about health. I'm not a health expert, but the New York Declaration contains 12 references to health, almost always in conjunction with education, other social services, etc. So you will see usually a long list, refugees and migrants alike have a right to health, to food, to water, to education, etc. But health is not explored in any depth at all in the New York Declaration. There was a side event on health that was organized at the GA last year. IOM and WHO have held 2 global consultations on global health. Court was at at least the one in Colombo, really to try to spell out what are some of the health issues that need to be addressed in looking at migrants. There have been regional processes that have referenced health, but again, most of it is very, very general. The Colombo Declaration, I think, goes further, and it points to an area where I think there's possibility to do more, and that's this continuity of care. One of the issues that came up in 2015, particularly with the movement of unaccompanied children throughout the region, was at least some NGOs, Save the Children, for example, started setting up mechanisms to share information. Unaccompanied child X has TB, is coming your way. Telling Save the Children in the next country on the Balkans route back when that was open, to ensure that child would get the kind of medical care that he or she would need. I would think there would be support for doing more on that continuity of care. On this question of access, it's a big issue in the United States and in just about every country, particularly for irregular migrants. Should irregular migrants have access to all forms of health care? Seems to be an acceptance emergency health care, yes. But what about more sophisticated care? Certainly the experience of refugees who are recognized by the government, have different levels of health care availability or access to healthcare at different levels in different countries and different times. In some countries, refugees can get access to primary healthcare, secondary healthcare, really sophisticated treatment, cancer, not so much. And so looking at access to healthcare is a question of resources, justice, and also some of the differences between refugees and migrants. Everybody is calling for integrating migrants and refugees into national healthcare systems. That doesn't seem to be controversial. It doesn't happen very often. Georgetown, we recently had a meeting on the particular health needs of young Syrian refugees, 0 to 3, who have physical disabilities or who have particular needs. And the gap is just striking. On paper, they should have access to national health systems, and yet national health systems aren't very good for poor Jordanians or Lebanese, and the extent to which refugees are able to access those services is minimal. The Global Compact on Refugees is talking about health. Actually, there's a meeting next week where health will be on the agenda. UNHCR has suggested some of these measures as possible ways to include health issues in the Global Compact on Refugees. Stay tuned. And, I don't know, maybe all of you aren't such policy wonks, but if you want to follow this, you can trace the way in which health comes in the very first draft. Then you can probably, I hope you will see the impact of some of the health advocates. Maybe it's not mentioned in the 0 draft, but maybe by the next month it's there. And maybe by the next month, you see it more fully developed. These global compacts, because they are multi-stakeholder processes, are open to the input of advocates, researchers, civil society organizations, NGOs. So there is an opportunity to influence this, either directly by sending information into those writing the compacts, or by influencing our governments. Make sure you push gender issues. People working on gender have been very strong in trying to get gender incorporated into every aspect of these compacts. Okay, maybe I'll stop there and see if people have questions. I feel like I can go on and on, as you can tell. But.
Thank you. You stay right there. I will be the roving mic manager. Test. Are we on? Oh. There we go. So just raise your hand and maybe just introduce yourself. We don't need name, title, and rank and serial number, but just a little bit about who you are. Surely there's questions or comments. Paul? Yeah. Okay.
I'll just start it off. Thanks, Beth. Very, very interesting. What you had mentioned, when I was at UNHCR, I tried and failed to get health much more into even the New York Declaration. And I've been trying here or there, but I actually haven't really succeeded. And I would like to know how you think we could, both as faculty and students, what are some ways to try to influence this? Is there a way, should we be getting a group of academics together to come up with a statement and send it? Should we be joining with some of the health NGOs? And then finally, who should we be doing this with?
In terms of refugees, UNHCR is running the show. Providing a short statement can go on the website. They take everything. More people should be running for the website because there's a ton of information. So that's number one. Number two is talking with people at UNHCR and people participating in these negotiations. Some of the health NGOs are very strong. But my personal observation is some of the health NGOs are so focused on operations and program that they see all of this diplomatic stuff as not so interesting or relevant. But if you got 4 or 5 of the big health NGOs to issue a common statement, I've talked with Médecins Sans Frontières, and I think they're willing to take the lead in terms of coming up with a statement that would if you can organize a side event for governments at these meetings, and there are going to be lots of negotiations in Geneva. Pick one and organize a side event, which doesn't take a lot of money. And if you offer sandwiches, most of the diplomats will come. So there are ways to, influence those processes.
Thank you. I'm Mohammed. I'm a PhD student. So my question is about Colombo statement. As I remember, that in 23rd of February, that 40 countries they decided to address the challenges that facing the health needs of population of migration, and then they decided that in the World Health Assembly in May 2017, as I guess, that they wanna that the 194 countries they wanna decide to do something practical actions to solve this problem. So my question: what did they decide to do? What are the practical solutions for this?
I don't know, maybe you want to speak to this, Court, in terms particularly the relationship between the World Health Assembly and the Colombo Declaration. WHO was a co-sponsor of the Colombo meeting, I think, along with IOM and,
right.
and others. But what were the practical things that were recommended beyond the...
Now you're challenging my memory on the global consultation. I, by the way, was a observer. We're not signatory to that because we were simply a mere academic and NGO. It was government organizations. My recollection was a couple of points. One was and the Sri Lankan government was really actively promoting this. In fact, we were given a dinner at the president's house and the rest. So they made a very high visibility sort of statement and presence to say governments must establish national plans of action. I think that was one of the first sort of points around which they were trying to promote consensus, that whether you're a sending country or a transit country or receiving country of migrants and or refugees, you needed to have a plan of action. One of the points of emphasis was integrating into national healthcare programs. There was a lot of discussion about how to promote programming, promote research. I was on a working group to promote a sort of global agenda for research in migration health. It didn't get incorporated into the Colombo statement per se, but we had follow-up meetings just a couple of months ago where we've been sort of promoting ideas to put forward to governments, UN, NGO, academics, and other actors, this multi-stakeholder perspective, to try to promote a research agenda. I'm blanking on another point that was in the Colombo statement. I just can't sort of bring it to mind, but I would say that basically the focus was to promote both some plans of specific recommendations, but in a sense a model. I think the Colombo statement was about a government, a national government, saying we are representing a country and we stand for these principles and we endorse them. And the mere hosting of the meeting and the issuing of the Colombo statement, I think, was in itself a kind of a concrete step. Thunderous silence in the last year in terms of other countries stepping up, and I think Beth's point is quite well taken, that on a lot of these issues, it's the countries whose populations are in migration, in displacement, that are speaking on behalf of these rights and needs for protection. The receiving countries are really more about the securitization of this. Who comes in and gets vetted properly? And if there is a health response, it's how to deal with infectious disease, the Class A, Class B conditions, what's waiverable, excludable but waiverable, what's categorically excludable, what's so forth, what's allowed to be processed into the country, and then permitted access with hopefully proper treatment and follow-up. There were some points about continuity of care. I think we have to go back to the statement to look at that. But I think these points are what the framework and the statement really were trying to get at, is if there's not coordinated action led by national governments, then we just evolve down into this sort of endless process of dialogues and meetings and exhortation and encouragement, and there's really no commitment. So I think that as a country, Sri Lanka is sort of stepping up, saying we're an actor, we're engaged, we're both a sending and receiving country. I think they're quite important in that respect. But it remains to be seen whether anybody else picks up on this and what of this gets incorporated into either the Global Compact on Refugees or the Global Compact on Migrants. I do also recall that sort of often, well, polite but heated discussion that you would often see with HCR and IOM. And I'm not trying to take sides here, but it is getting much sharper, where HCR is trying to say we are seeing a diminished focus on the protection needs of refugees. We're seeing this getting watered down. And IOM trying to say, but you don't get the point. The point is not about watering it down for some. It's about expanding the sort of, if you mix the metaphor, water and pie, more a share of resources for all. And it'd be interesting to get your thoughts on that. And you don't have to sort of vote one side or the other, but I really do think that has become the crux of the issue. And governments are often wondering whether taking the side matters, and if so, which side do they take? Do they wish to sort of stand down entirely? And I think the receiving countries are looking at this, as Beth said, it's a really toxic environment for this conversation to be happening. It's a terrible time to have the best opportunity we've had in decades to be talking about refugees and migrants, but so it goes. And maybe it's partly happening, although we couldn't prefigure all of this back in 2013, that these new forces of anti-globalization, anti-pluralism, pro-populism, pro-nationalism really are driving a conversation that is very real for lots of people in this country and elsewhere. And we need to sort this out. The concern is we won't get it sorted out. There won't be consensus. And if there is consensus, we may be backing up and putting new strictures in place for control, containment, quarantine, and not about opening up access and availability and continuity of care. So it's a very worrisome time, but I think we are challenged. I hope we all are by what could be possible for us to do, our Center for Humanitarian Health, as students, as academics, to be putting some of this stuff out there and promoting some ideas and making more concrete some of the recommendations.
Thanks. So, Mohammed, this is partially in response to your question. I was interning at WHO during the World Health Assembly, the one that just happened, the 70th one, and the specific recommendations, what they were trying to pass in order to get health adequately addressed was spearheaded by WHO. And they specifically, I just pulled up the document, what they wanted to do was encourage member states specifically to basically comply with a set of priorities and guiding principles to adopt their own national health policies and programs to address those needs. So it was really just trying to get the member states to agree based on a set of guidelines that was established within the UN. And then from the UN level, they wanted the Director General to have a specific set of frameworks and priorities that guided advocacy and research to establish what those practices should look like to encourage states to comply. So.
Maybe I'll just add a quick word on advocacy. Having been on really both sides, academics really like to write long papers, that are nuanced and footnoted and thoroughly make the case. That really doesn't work so well on an advocacy thing. If you have 3 bullet points, that's about as much as some of these processes can handle. If you can agree on 3 of these and frame them in a way that are understood by non-health, non-humanitarian people who will be making decisions. Children have a right to care in the country they arrive in, the country they end up in, whatever. If you have 3 bullet points, you have much more likelihood of getting that in than when you present beautifully written analyses that nobody has time to read.
Hi, thank you so much for this. I'm a third-year PhD student in international health, and I was really interested in that north-south divide and talking about recipient countries and sending countries. And the numbers just don't seem this way in the refugee side, with only Germany being in the top 10 of the recipient countries for refugees. Like, most of the refugees in this world are living in low-income countries. So the point of referring that responsibility that we heard of healthcare into those very poor countries who cannot even afford to provide healthcare to their own citizens, and the international community basically backing up and saying, okay, you deal with it, is kind of hard to think about. So I wanted to know how you see it. And I'm sorry, it's like I have a second question. Also, with too many cooks in the kitchen, which is something we have seen in SDGs as well, you find this whole huge list of objectives
Right.
with little backing. Like SDGs want 85% to be provided by local governments. And same will happen there. So how do you see this moving forward, or what can we do to advocate more support from richer governments?
Yeah, you're absolutely right. Almost 90% of refugees are in developing countries. You look at the number that arrives, this is not a crisis of numbers. 1 million refugees arriving in Europe is not a crisis. Europe has 650 million people. Their systems aren't working well in terms of dividing who's responsible, but it is not a crisis of numbers. I mean, if you look at the number of refugees, 21 million, their dirty little secret is that most of those have been displaced for 10 or more years. You know, the Syrians now are 5 million, but that's building on 4 million from last year. It's, you know, we're not doing anything really to resolve those long-standing displacement situations, which is where more energy is needed. Countries that are hosting large numbers of refugees have been very strident in terms of expecting much more from the international community. Lebanon right now, you know, has over 1 million Syrian refugees, population 4 million. 1 out of 4 people is a Syrian refugee. The Lebanese government has been very strong in saying, we need more help if we're going to continue to do this. And now the Lebanese government is saying, it's time for them to go home. We don't need to wait for a peace agreement. I mean, watch the reaction of countries when they don't get the support they need. You know, to continue to care for refugees without that support often leads to returns that are not voluntary. And in the case of Syria, I think that would be tragic.
Other comments or questions? We have a couple more minutes. It would be interesting to hear your thoughts about this. And again, I don't want to pitch it too explicitly as a dichotomous debate. It's one or the other. It's refugees versus. I mean, I think both of us would stand here and say it's refugees and migrants, and there's
Right.
protection and resources sufficient for all, health for all of that. We sort of subscribe to all that, but it's a hard world, harder maybe in the last year or two than it's been in my lifetime. And I saw a lot with the Indo-Chinese crisis and a lot of other things that seem historic and epic in their scope and scale of suffering. What's your take on that, and what's your thoughts on maybe, again, as we framed it before, what might be possible for folks here in the school to think about the 3 bullet point action steps, you know, policy brief, or something longer that we can sort of deliberate on that might be able to contribute, whether to the Global Compact on Refugees or the Global Compact on Migration, and put health, bring it more forward out of some of these just smaller sections within the New York Declaration and a lot of these other statements, and make it much more of a coherent statement about needs for response and also an action plan. Anyone?
You know, it's really difficult if you accept that governments have a right to limit who comes into their country. I mean, if you can argue all borders should be open and everybody should be able to go where they are, then you're not in trouble. But once you start saying that some people should get preferential access to enter a government's territory. Refugees already have it for those who have signed the convention. Are there other groups who should be allowed in, even while recognizing governments' rights to? I mean, it's really a big issue. The Office of the High Commissioner for Human Rights, for example, says all irregular migrants are vulnerable. That's true. All irregular migrants are vulnerable. But the governments take that and say, does that mean we have to let in all irregular migrants? You see what I mean? Once you start, if you can, identify particular groups that need protection and should be admitted in spite of immigration policies, then you're in stronger shape than if you just say everybody should be allowed to come, because no government in the world will buy that. So how you draw those distinctions is tough.
Randy, a famous alum from years prior.
Just last year. I'm aging well, thanks.
20 years ago. Yeah.
So I'm wondering where the development community is in being involved in both of these discussions with the refugees. Certainly, under-resourced countries need to have some help, and whether the help goes to the refugees solely, or the help goes to the country who's hosting those refugees to the benefit of the host country. I mean, during this discussion, I haven't heard any mention of the development community and what role they play in addressing these problems.
And it's a huge issue, and we've made a lot of progress on that in the last few years, particularly on the refugee side, where you've got, I didn't go into detail, but this comprehensive refugee response framework is based on the idea that development actors need to be involved from the beginning, and not just when a situation becomes protracted. I mean, the World Bank's position is really a game changer, their commitment to make $2 billion available to refugee hosting countries, and perhaps more importantly, to really challenge the mindsets of a lot of humanitarians who see host communities in terms of how well they welcome refugees, rather than seeing refugees as a shock to the development aspirations of the host country. And how do we address that? I think humanitarians are getting much smarter at working with host communities and not saying, well, we're going to give health care, a good example, make a clinic available for refugees, and those of you poor neighbors from the country who don't have access to health, well, that's not our business. There's a lot more effort to integrate that, and I think that's a very positive sign. On the migration side, development actors have always been involved. Not always successfully in terms of incorporating migrants into national development plans, but they've always seen that migration and development go hand in hand, and migration is a tremendous driving force for economic prosperity in the world, and have made that case in many forums.
Beth, I want to ask you a question. I mean, we talk about the always with the students. I'm trying to talk about what is the ideal situation and then the politics. And you right now, I understand, and even when I was with HCR, there was a lot of concern in this climate of opening anything up,
right?
And which is one of the reasons why they said we're not going to open up anything for the refugee because it's going to be reduced, watered down. And frankly, I understand and would agree with that. There is an incredible opportunity to try to combine and have minimum standards for everyone, but given this political climate, I mean, we're all very concerned about the Compact for Migration for that very reason. And with the refugees, if you open it up, there could even be a potential of watering down the definition of a refugee. So, from a political point of view, and realistically, and this is the tough question, do you agree with that situation now? And if we were in a completely different political climate, maybe it would be different. So that's number one. What's the difference, and how do you, as both an academic, but then you worked for years as an NGO, how do you try to differentiate between the ideal and the political component?
On the first question, I agree that this is not the time to reopen the Refugee Convention. I think most people would agree, one, it really needs updating. For example, there's no mention of gender, no mention of internal displacement, no mention of persecution by non-state actors such as criminal gangs. I mean, if we were writing it from scratch, we could come up with a much better document. No mention of those displaced by environmental reasons. But if we were to open it up, I think everybody agrees governments would love to renegotiate this, and they would come up with something much more restrictive. And maybe it's possible to think about an additional protocol to the convention. We've done that before. Maybe we can think about that when the climate changes a little bit. So I think that's possible. I think advocates always struggle with this, what's possible and what's ideal. In this country, some of the work on immigration reform has been bitter struggles, say, within the human rights community. Do you go for a deal, say, for example, with the Dreamers now, the DACA? Do you, just get an extension of the DACA agreement so that the kids can stay a little longer? Or do you take on what happens to their parents and all of the immigration issues? Ideally, you take it all on. That's not politically possible, probably. But, how far do you compromise? And how far can you compromise and still maintain integrity, I think, is a question all advocates struggle with every day. You know, you got to compromise to get something done, but you compromise too much and you've lost your credibility.
You should probably speak into the microphone just for the sake of webinars and such. I think we've run out of time, so I'm just going to thank our friend and colleague Beth Ferris again. And without making too many commitments, I think you've challenged us in a couple of explicit ways. One is, could we come up with some operationalize what does it mean to be a migrant in vulnerable situations? Form a working group. I'd be happy to help coordinate that. If you wanted to, some students wanted to join in, you could maybe do a capstone paper. Plug. I teach a course on migration and health. You could write a paper on this for the third term course in migration and health. What a wonderful idea. But I do think we are challenged by this opportunity. You know, as Beth said, possibilities and pitfalls. We could go backwards. We could, by opening up the debate, have governments saying, no, we have to securitize first, protect our borders, keep ourselves strong, and keep foreigners and alien diseases and ideas out. At the same time, maybe this is a fond notion. I think we are also aware that mobility is at historic levels, and we have an obligation to seek health for all, and this is an opportunity that we can't let go by, and we would not want to look down the road a year or two out and say, gee, we didn't even weigh in. So I think that's the challenge for us, is what can we do to weigh in, whether that's 3 bullet points or a 30-page paper with footnotes.
Or both. Both would be good.
Or both. So that's the challenge, and hopefully this has stimulated some thinking on your part. Happy to continue this conversation both within this seminar and in other venues around our campus. But again, thank you, Beth, and we look forward for further collaborations between our two institutions.
If you ever get to Georgetown, let me know.
We may do a field trip. Thank you.